In Lesson 5 of the Zambia Institute of Sport, TVETA and National Sports Council of Zambia accredited Sport First Aid course, we tackle wounds and bleeding. A wound is an abnormal break in the skin or other tissues of the body that permit the escape of blood internally or externally and may allow the entrance of germs or infection. All organs of the body depend on an adequate and uninterrupted supply of blood in order to survive and function, and any substantial loss of blood is dangerous. The degree of danger depends on the amount of blood lost, with injury types ranging from cuts and grazes to more serious cases with embedded objects, severe bleeding, or shock. Learning outcomes from this lesson include an appreciation of types of bleeding, general rules of treatment, treating cuts and grazes, treating wounds with embedded objects, treating bleeding from specific areas, treating severe bleeding, and shock. Dealing with body fluids always calls for care, especially when exposure to viruses like the human immunodeficiency virus, HIV, and hepatitis B can occur. The risk of cross-infection should also be kept to a bare minimum. Cross-infection can be guarded against when dealing with body fluids by measures such as the measures used to minimize the risk of cross-infection include wearing gloves. There are two types of bleeding. External bleeding that can be seen at the external bleeding occurs when any of the blood vessels are cut or torn, and general rules of treatment require that you take precautions and follow guidance to avoid. There are, however, general rules of treatment that must be followed, starting with examining the wound. The first aider should also place a sterile dressing over the wound and check for shock. Though with small cuts and grazes, the bleeding often stops of its own accord, controlling bleeding and preventing infection are the key aim for the first aider. Treatment starts with sitting the casualty down, raising the injured part. For a small cut or graze, apply a plaster to the affected area, taking care never remove an object that is embedded or stuck in the wound, as to control bleeding, protect the wound from infection, and immobilize the affected area. Treatment of a wound with an embedded object includes pinching the edges of the wound together and applying pressure to control severe bleeding. Also, help the casualty to lie down and raise and support the injured part. Drape a piece of gauze over the wound and the protruding objects to guard against shocking other non-medical bystanders. In Lesson 5A, we tackled the different types of bleeding and treatment methods. We also looked at cuts, grazes, how to deal with embedded objects, treat severe bleeding, as well as shock. All injuries, whether major or minor, call for urgent care and attention, lest they become infected and develop into more serious conditions. The first aider's role is to intervene in this regard. For further information, refer to pages 41 to 49 in the first aid manual. You can also visit the link provided at the bottom of the slide.